the reason why we publish that is because it's not all cut and dry. A lot of studies have been done, but it's very hard in using a treatment such as a bone marrow transplant to do a properly controlled, blinded, double-blind study, which is the hallmark of the highest class of evidence that dictates a medicine is effective. It's very hard to do that. It's very hard to hide the fact that you've had a bone marrow transplant. People lose their hair and their fingernails fall out and their eyebrows disappear. It's pretty hard to blind an investigator that you've had a bone marrow transplant. But the notion behind it is that in certain patients, and in many patients, we don't have a way of proving one type of MS is going to be going the wrong way or whatever. It may be a different mechanism that's driving patient A and patient B. We've identified so many immune mechanisms that are at play, and even within the same patient over time, those immune mechanisms that give rise to the disease may change. That's the reason why a drug can work for a little while, and then it doesn't work, and we have to switch them because we have to switch with something with a different mechanism. The notion of a BMT is that regardless of what the immune problem is, you're removing the immune system and you're replacing it with a brand new system that's developing from the patient's own stem cells. So there's none of this graft versus host problem that you have with transplantation, patients getting their own cells, and you're remaking the immune system. And we think the fact that when patients remake the immune systems as an adult, whatever the cause for the disease is still in the body, but that immune system grows up in the presence of that and becomes tolerized, so it doesn't reject the brain anymore, because this is an autoimmune disease wherein the immune system is recognizing some component of the brain, something in the lining of the wires, the insulation of the wires in the central nervous system. They're called myelin, and it's recognizing a component and trying to target it. Now it doesn't do it anymore. So now which patient would you do that in? And it's not a trivial treatment. You probably don't want to go through more than one bone marrow transplant in your life. We use essentially chemo poisons to remove the old immune system completely. And we're using very powerful drugs that we can get into the brain so that it gets rid of the immune cells that are there and everywhere else where they might be hiding in the body. And then literally at a stage when those cells are near death, we replace the immune system with the patient's own stem cells and grow them up very quickly so that they can protect the body and do what the immune system does. But it takes time, and we have to cover them with everything under the sun, antibiotics and antifungals and antivirals, and support them as they grow. And it takes probably a year out of a patient's life. But then after that, they don't need to take any more disease-modifying drugs.